This video will demonstrate an effective and time-efficient technique for placing multiple ceranate lumineers with only cosmetic contour preparation. This patient wanted a straighter, wider smile, but never thought it could happen without orthodontia or pain, until he discovered lumineers.
And I never thought we could do it in such a short period of time without any pain and with such good results.
Today, this patient will get his wish with the placement of 10 lumineers on the upper arch. This procedure took less than an hour and required no shots, no drilling, and no removal of painful tooth structure. Lumineers by Ceranate are fabricated for custom results by highly trained technical artists exclusively in the Ceranate Smile Design Studios. Ceranate lumineers are made from Ceranate porcelain, a patented porcelain manufactured and used exclusively by the Ceranate Smile Design Studios in Santa Maria, California. The unique physical attributes of this porcelain allow the creation of ultra-thin, ultra-strong Ceranate lumineers. The teeth to be bonded with lumineers do not require standard painful tooth preparation. Sound tooth structure does not have to be sacrificed because Ceranate porcelain is exceptionally strong. Lumineers provide high-strength aesthetics and yet are thin as a contact lens. Ceranate porcelain can be bonded to all intraoral surfaces including enamel, dentin, composite restorations, metal restorations, and existing porcelain restorations. First, sit down with your patient and complete the smile evaluation form. Then take an accurate impression. After the smile evaluation and the impression have been completed, fill out a studio prescription and diagnosis form that clarifies specific preferences of shade, surface texture, and contour. The studio request form and the impression are used by the Ceranate artists to fabricate the lumineers. Prior to placing, each lumineer should be treated with Ceranate porcelain conditioner and Ceranate prime. Afterwards, paint Tenure S onto the primed porcelain surface. After the teeth are thoroughly cleaned, they are etched using Denmat's medium viscosity etchant. All 10 of the teeth are etched at the same time. The etchant is rinsed and the tooth surfaces are dried. Paint each tooth with several coats of Tenure A and B, a self-cured adhesive bonding agent. After a few seconds, a shiny appearance on the tooth surface should be seen. If necessary, reapply more tenure and air dry until the desired results are achieved. Also available is light-cured Tenure Quick, which bonds to all composites regardless of the method of polymerization. Apply a layer of Tenure S to the teeth to protect against possible contamination. Remember, do not light cure until the lumineers have been placed on the teeth. Seating is done with the use of Ultrabond resin cement. Ultrabond is clinically proven in over 20 years of clinical success bonding Ceranate porcelain. Ultrabond is exceptionally effective for this type of restoration. Ultrabond is a photo-initiated, dual-cure composite resin cement, which continues to cure once it has been light-activated. Ultrabond is now available in an easy-to-use one-step system. The lumineers with Ultrabond are gently seated on each tooth, one at a time, with enough force to extrude all excess cement. Note there is no need for interproximal matrix strips. With the lumineer fully seated, the excess Ultrabond is removed by using a brush dipped into Tenure S unfilled resin. Check that all of the excess cement has been removed before light curing. Cure with the award-winning Sapphire Light. With the use of the Seri Taper 2 mm tacking tip, you can also reduce by 50% the curing time. The cured composite resin on the lumineer's surface is easily removed with a Shure 349 instrument without damaging the porcelain. The remaining excess cement adjacent to the laminate is removed using a flame-shaped 12-bladed finishing burr. This fluted finishing burr selectively removes only the composite resin cement, without damaging the aesthetic glaze of the Serenade porcelain. All overhangs must be removed during the finishing process. A fine diamond burr is used for the final finishing of the porcelain margins. Smooth, seamless margins are essential for long-term periodontal health. This technique requires the use of magnification to reduce the shoulder created at the gingival margin. Because the porcelain laminates are bonded without the use of matrix strips, the interproximal contacts are fused together. It is important to reopen these contacts. The gross excess is removed with a finishing burr and the use of an interproximal dental saw, a seri saw. Before dismissing the patient, adjust the occlusion and centric throughout all excursive contacts. Now available, a custom-designed, all-inclusive kit has been created to make finishing faster, easier, and better. These tools can be used for multiple dental procedures. This technique for placing multiple lumineers demonstrated in this video provides you with substantial advantages. Tooth structure is preserved. The procedure is simple to learn and time efficient to perform. Serenade restorations are exceptionally beautiful in appearance, and Serenade porcelain has been clinically proven in tens of thousands of cases to be exceptionally durable and reliable. The technique for multiple placement of lumineers with the use of Ultrabond and tenure are also backed by a limited 5-year warranty. Your patients will notice a dramatic change in their smile. The following products are required in order to complete this procedure: Lumineers by Serenade, Serenade Prime and Conditioner, Denmat Liquid Etchant, Tenure S, Tenure A and B, Ultrabond, and the finishing kit.
There's no way that I comprehended that you could change the appearance of my smile in this amount of time without pain. It just is mind-boggling. It changes the whole way you think about dentists. Can smile with all of the best of them now, and I'm happy to be in a smile off with them, and I just keep smiling because I'm proud of my teeth and I know they're as good as anybody else's. So if you have any part of your smile that you don't like, I think you're crazy not to look into it seriously, because it is pain-free, it doesn't take a lot of time, and those two things and dentistry are not connected, but in this case they really are. I mean, it really was without pain.
For more information, contact your Denmat account representative at 1-800-445-0345.